Hi, welcome to What's the Word? I'm your host, Jamie McFadden, and I'm so excited to have you here. This podcast is about all things wellness. Each week, we will focus on a word of the day, and I interview some of the most inspirational people I know and share that inspiration with you. Join me, let's learn together on What's the Word.
This is the place where I belong.
Hello and welcome back to What's the Word? I'm your host, Jamie McFadden, and today is a very special guest that I am so excited to introduce, Dr. Nicole Muller. She's a licensed clinical psychologist and specializes in trauma and EMDR. Today, she chose the word acceptance, which by definition means the action of consenting to receive or undertake something offered. Hi, Dr. Nicole, how are you?
I'm good. How are you?
Dr. Muller. So little backstory to everyone that's listening or watching right now. Dr. Nicole Muller and I go way back to the point where I even went by her maiden name when I reached out to her about this. So for me saying Dr. Muller, I'm like, oh my gosh, that's so amazing. Yeah, how are you doing? And thank you so much for being on the show.
I'm good. Thanks for having me.
Yeah, so you chose the word acceptance, which is one of my all-time favorite words. And I think is definitely a word that will resonate with many right now listening to this. What does it mean to you and why did you choose that word?
Sure. So acceptance for me, I chose it because it's something that in my practice, I think is the most important. It's, I think in mental health, pretty much the most important piece. And it sort of goes contrary to what we typically think of with mental health, which is like symptom reduction, change the way you feel, this and that. But for me, being in a state of acceptance is really being present in the moment without trying to change anything, allowing space for what's there and just allowing it to just be.
Wow, I love that. Wouldn't it be amazing if we could all have a little bit more acceptance within ourselves as well as others?
Definitely. It's definitely
Yeah.
a time where acceptance is not on everyone's mind all the time, but people do seem to resonate with it once it's introduced.
Yes, absolutely. And for those of you that don't know my past relationship with Dr. Muller, because you probably don't, just a little bit of a backstory here is that we have known each other for, I don't even know how many years, a long time, let's just say.
A lot of years.
A long time. And we both had experienced some pretty traumatic events in our own lives and some pretty tough stuff that we went through. And the reason why I reached out to her is because she is someone that has always inspired me. She is always someone I've looked up to in numerous ways. And I feel that both of us have taken the experiences that we have gone through in our own lives and have been able to work through it and have been able to come out of it on the other side and also be able to use what we've learned and then go through, school and getting certifications and all these other things and actually go put to use what we can to help others, hopefully maybe have some preventative care for things that seem to be coming up. So I'm really just so happy to have you here. And when it comes to acceptance, Dr. Muller, what would you say is kind of the biggest tip that you could offer to someone listening right now? Because I know that it's really hard for people to accept even themselves.
Yeah, I guess I'd have like two. The first one being always make space for emotions, because often we try to push down emotions that we label as like bad or unpleasant or things that we don't want to have. But there's no such thing as a bad emotion. So as long as we can allow space for it, we can be accepting of being sad or being angry or being frustrated. And the other one would be to just be present, practice mindfulness, and just be present in the moment.
I love both of those so very much. And now can you tell us a little bit about your journey into kind of where you're at, but also utilizing that word acceptance, like what's your journey been?
Yeah, sure. I mean, it goes back to the days that I knew you when I really was not happy. I was really in a dark place, and I went through a lot of darkness, whether it was depression or substance use, and really not liking who I was or where I came from or where I was headed. And I think there was a point in my life where I realized, like, if I don't make a change, I'm not going to be able to go anywhere or do anything. And so I started to fight really hard to find meaning in what my experiences were. And that things that felt really ugly and uncomfortable, they could be really meaningful. And so I went back to school and I started to work with teenagers, and I started to, give back in ways that felt right to me. And I would have told you back then, or most of the time, that I'd always work with teenagers because that's when it was the hardest for me. But as I went through it, I really learned to like adults and working with adults, because teenagers are so hard in that trauma, because you're right in that trauma and it's not easy to accept who you are through those years. But once you kind of come out to that 17, 18, 19, 20 and older, there's a bit more understanding of what it means to be on a journey. And so for me, coming to accept that what I went through in my life has meaning and that I can give back to others, it really helped me to just keep going. And I fought hard to get this doctorate. I mean, I fought really hard to get it. It wasn't like it came easy, and it took a long time. And I just think never giving up and accepting that my journey was maybe different than everyone else that I was in class with. That was okay.
Wow. It is so wonderful to hear that, because it's simple yet profound, the word acceptance, in terms of, we could all say like, yeah, I want to be more accepting. But even what Dr. Muller is saying right now, really about realizing and embracing the journey of where you are right now. So many people who listen to this podcast will reach out to me at some point and say, wow, I'm going through this tough time, whether it's a breakup, whether it's depression, anxiety, sleep deprivation, all of these tough times. And to be able to hear, and that's why I really wanted you on the podcast, because I want people to realize that it's not always all roses, and
Yeah.
we all go through stuff, but a big part of it is what we decide, how we make that experience our own. And you've done such a wonderful, fabulous way. I mean, right now, your family, you have two sons, right?
Yes.
Two young twins.
Twins. Yep. Twins.
Yes.
6 years
Wow.
old.
So you look at that. So here she is. She's helping people out in the community through doing the trauma work that she does. She's raising two beautiful sons. You live, down south. I know that. But what right now are you most excited about as we head into, getting into, even, gosh, it's going to be summer before we know it, of 2022. What are you most excited for this year in terms of, the work that you're doing? What would you like to see?
Yeah, I'm really excited for the trauma work. I'm loving doing EMDR. I'm seeing amazing changes in people in such a short amount of time. And I've recently started doing EMDR with addictions. And that's been also really life-changing to see people working through trauma and then focusing on addiction and seeing people that are really seeing changes in their life, because there's so many, addiction's so hard and trauma's so hard, and there's so many different techniques out there where people are going through therapy for so long and they're not seeing any changes. And it's great to see changes happening in just a few sessions for some. It's just fantastic.
Can you get into a little bit, for anyone that might be curious, like, what is EMDR?
Sure. It stands for eye movement desensitization and reprocessing. And so what it is it works through your eyes in the same way that it would like through REM sleep. It doesn't always have to be through the eyes. When I first started doing it, I did tactile. So it was through, just touch. But basically what you do is you stimulate both hemispheres of the brain. So it's bilateral stimulation is what we call it. And so the idea being that when you process a traumatic memory, you process it through the right side of your brain. You have images, you have emotions, you have like intrusive thoughts, but you don't have the words, you don't have the clear story with a beginning, middle, and an end. And once you're able to kind of process it while stimulating both hemispheres of the brain, you're able to tell a full story. You're able to have a beginning, middle, and an end. And it puts some distance between you and that memory. It doesn't make it go away. It doesn't make the trauma disappear, but you're able to look at it from a more detached place. You're able to say, okay, this happened to me, but it doesn't hurt so bad anymore.
Wow. And what can you describe kind of what a session doing that is like? Is someone,
Yeah.
well, yeah, that'd be great to just paint
So
that
I always,
picture.
yeah, absolutely. I always start with like a guided imagery. So kind of like a safe place, a comfortable place. And that's to kind of get the person out of the fight or flight. So when you're in the fight or flight, you're activating the sympathetic nervous system. And what we want to do is get you into the parasympathetic nervous system, which they call the rest and digest. So once you're there, you're able to sort of access this memory a little bit more. And then we'll ask for you to kind of come up with the image that represents the worst part of it for you. And once you have that image up, We do the bilateral stimulation. So it can be, you do different things. Some people do a finger back and forth on a screen. I sometimes use a light back and forth on a screen. I've used sound. I've used the tactile with buzzers where you hold a buzzer in each hand. I've done tapping, the butterfly
Yeah.
tap that kind of looks like that. Any of those things will work. And then you just kind of let whatever happens. And I'm just there as a guide. I do very little. It's really all internally what the person is going through and just kind of checking in and saying what's happening for you now. And sometimes I might guide them, okay, we'll focus on this part of it or focus on that. But it's really each person's individual journey. And what's beautiful about it is you can share with me what you want and you can keep private what you want. And that's a really beautiful thing.
Wow, I want to do this. This sounds amazing. I love it. Well, and speaking of that, are you currently taking any new clients? What's kind of the scope there? Because I definitely want to, shout about you and what you're doing.
Yeah, absolutely. I am, but only through telehealth right now.
Okay.
I'm looking to kind of be more in person in the future, but I'm pretty booked solid for a lot of stuff these days. But I am taking new telehealth clients.
Okay, that's good to know. And what would you say when it comes to, I mean, I know I've been, kind of seeing the stats and talking about it with another really close therapist friend about just the mental health crisis going on right now in the world based on the last 2 years of everything. And what would you say, like, do you see any light at the end of this tunnel? What do you think is some strategies that we can start putting into place as a community or even as an individual in
Sure.
regards to, taking care of this?
Yeah, well, I think the worst thing that happened to us was all that isolation because we really are people that are driven by socialization, by a sense of community. And I think the more that we become together and the more that we can be together as a community, I think that's where you'll see the light at the end of the tunnel. Sitting in your house, scared about COVID, not being able to talk to anybody. I think it just really, it drove substance use up, it drove trauma up, it drove anxiety up, it drove depression up. And I think the more that we can remember how much we are alike and how much more we are alike than we are different, that's where the light at the end of the tunnel is, because we have been so focused on how we're different from one another. And it's minuscule compared to how much more we are alike.
Wow. Everyone needs to take that in for a moment because I agree with that 110%. I always say with my clients and everyone, we are one. We are part of the source. We are all
Yeah,
connected, whether we know it or not. That's why there's so many of moments like even meeting you. Look at our journey, our trajectory
true.
of even our friendship and how it's evolved. And that's because we're connected. So now, what would you say? You have two young children. I have one. We obviously, I'm sure at some point, knowing what we've been through in our own lives, are going to be like, oh, okay, like put
Yeah,
the bubble wrap on you, kid.
yeah.
What do you think that we can do, or is something that can be helpful to the youth, to our children, when it comes to mental health and wellness and acceptance?
I think modeling, what you want your children to see is the most important. For me, I do breathing with my kids each night. We have like mindfulness books where we sit and read about like sensing in with the body and practicing being present and things like that. And I think what I want to see in my kids is an ability to slow down, an ability to kind of take life as it comes. And so I try to practice that myself so I can show them that. But when I notice that I'm getting like tense or I'm getting hyped up, and then I see my child modeling the same thing, I have to really check in with myself. So I think really taking care of yourself is the number one thing that you can do for your children. And even if you feel like, they've already seen me, do all these things that I don't want them to see, it's never too late. I think seeing a reparative place in a mother or a father, I think for a child shows them that no matter what you do, you can always change. You can always be better.
Wow. And now I have to ask you, because you kind of tapped in on it. What is your self-care routine look like? Like, what do you do for yourself?
Oh, that's a good question. I mean, well, I get up in the mornings obscenely early to exercise before I go to work because I work early. And even if I just get 20 minutes in, it just changes the tone of my day. It's the difference between being tired and sluggish and feeling like I'm walking around smiling and waving at everybody. And when I come home, I try to spend some quality time with my kids. I try to put my phone away. I try to be present. I do breathing with them at night before bed. So I kind of model it, and I don't even really tell them to do it. I do when they're worked up, but I hear them doing it next to me because I'm doing it. So they're kind of learning like, okay, this is how you go to sleep. This is how you kind of decompress from the day. But I think another one that's really important is when I have a hard day, because working with trauma, sometimes it's hard and I come home and I can't, talk to my friends about it, talk to my husband about it. It's hard and it's private. And for that, I always try to come up with a little ritual. So for me, it might be like coming home, taking a few minutes alone in my room, snuggling with my dog, reading a book, and just like decompressing and saying, now I'm not going to think about it anymore. Maybe it might involve some breathing, maybe it won't, but always having a ritual that I do to kind of let go of whatever stress I had from the day.
Wow. And I think that one, especially just you brought up letting go
Mhm.
for any of us. And I hear this constantly with clients. There's a really tough issue of wanting to control the situation or the things that we can't control and we're holding on to
Right.
so tight.
Yeah.
Do you have any tips on letting go?
Yeah, I mean, that's where acceptance comes in the most, it's just accepting it in the moment, just being present in the moment, because we do want to control. And there's so little that we can actually control. And just letting yourself be in the moment, taking a breath and saying, like, here I am, I'm right here. I can't control everything. And it's okay.
Yeah, that's a really big one. And who in your life has been kind of like your biggest inspiration?
Probably my mom. Yeah, my mom, she worked hard. She worked hard until the day she died, and she supported me every step of the way to keep going with school, even when I thought that I couldn't do it, even when it felt too big and too hard. She just held my hand and stood by me. And it was hard to not have her at the end, but
Mhm.
I think my kids inspire me and my husband too, but my mom's really the one.
Of course. And I remember your mom will talk about a light in this
Yeah,
world. Yeah,
definitely.
your mom is her. I still can feel her light right now, even just talking about it. So I really, really appreciate you bringing that up and acknowledging that because it is true. And I think for all of us, there is that special someone in our life that, and we're going to have many of them, but that, for me, my dad, and he passed away when
Mhm.
I was 18, he's the inspiration behind everything I do today. So there's no surprise that that once again just represents that connection that we have and the acceptance that we can't. I mean, of course I wish he could be here and go give him a big
Sure,
hug, and same with, I'm sure, you and your mom, but to be
absolutely.
able to live that legacy out and to be able to still acknowledge and embrace the love and the inspiration that we get from the people around us, whether they're currently physically present or
Mhm.
not, is
Mhm.
really important. And is there any kind of final thought, final word that you would want someone to walk away with today as they're listening to this interview about, their own journey with acceptance?
Yeah, I think that we all share the human experience. And I think that, we are often forgetting that we are humans first and we're all this other stuff second. And if you feel like you are having a hard time accepting or you're trying to control, reach out, talk to somebody. And there's people that are there. And even the people you might think are different from you, they share that human experience. And that's huge.
Yeah. Oh, I love this. I'm so happy to have you on What's the Word. It is so great. So please be sure, I'm going to be dropping Dr. Muller's website for you, and you can check her out there. She did say that she has some telehealth potential appointments, and we'll see what else she's going to be doing in the future. But right now, thank you for all that you do. Thank you for the ways that you give back and the ways that you inspire. And to anyone really that's listening or watching right now, just know this is coming from two human beings who have been in some really tough situations, even together. And we'll get to that maybe someday. But just know that we are all, and Dr. Muller said this, we are all capable of change.
Yeah.
And even if, and I think for both of us, let's be honest, sometimes looking back, there were moments in my darkest times where I wanted to believe that,
Yeah.
but I was like, am I really? Am I worth it? I don't know. Right. And just take it from the two of us, please, that you are definitely worth it. And there is a lot of support out in the world there when you put yourself out there. So thank you so much, Dr. Muller.
Thank you.
Yay, you're such a rock star. Well, thank you all for joining us on What's the Word, and we'll see you next week. Bye.
Thank you for joining me here at What's the Word. Follow us on social media with the links on the screen, and don't forget to like and share with your friend. Your support helps us grow and continue to make inspirational content. See you next time on What's the Word.